So welcome everyone to our third Southeast Asia Regional Healthcare Professionals Network meeting. As you know, we have been holding this for the past year and it has been very successful. We did have 80 registered, so that means they will all have access to the video recordings as per previous network meetings if those were unable to physically be here today. But thank you everyone who has managed to dial in from different parts of the world. So I'd like to welcome everyone new and old here and all the guest speakers. The past 2 months has been very busy for Action for Diabetes and the Southeast Asia healthcare professionals who has, we've actually presented several of our initiatives in European Society of Pediatric Endocrinology in Rome. And just 2 weeks ago, here's Jerry and I, we presented our initiatives in International Society of Pediatric and Adolescent Diabetes in Abu Dhabi. Thank you to so many of you who were part and parcel of all the initiatives that we have presented, including the papers that has been published from the Laos data, the paper on closing gaps in Southeast Asia for type 1 diabetes, and the recent presentations on the pandemic maintenance of supplies to Southeast Asia. We also presented the Hello Type 1 Digital Platform Initiative, and we presented the initiatives on the start of the webinars and our regional network. So I'd like to welcome, next slide, please, just to show you the agenda. We will invite our co-founder, Jerry Gore, to talk about our ESPE Innovation Prize, and the rest of the agenda, I'll be talking about the presentation in Rome that I did on the webinars and network initiative. Dr. Amphayvanh will be talking about the Laos publication, and I really like to welcome Priyanka Rai from JDRF, who will be presenting the Type 1 Diabetes Index. AC will talk a little bit about the webinars and the further progress that we have in place over the next year on Hello Type 1, and we'll open the floor to everyone. I'd really like everyone to join in. Please don't be shy. You can type in on the chat throughout the presentations. It's an open floor. We want to get everyone's heads together on how we improve our type 1 diabetes outcomes in Southeast Asia. So without further ado, I'm going to invite Jerry to talk about the ESPE Innovation Prize, and congratulations to the Action for Diabetes team on this really prestigious prize.
Hi, everyone. I hope you can hear me. I'm speaking to you from a very cold and dark Devon in southern England, but my heart is full of light and warmth because I've got some really great news that directly concerns all of you here today. Let me just, there we go. So last week, I attended the ESPE annual conference in Abu Dhabi in the United Arab Emirates. It was very hot there. On behalf of Action for Diabetes to accept their ESPE Award for Innovation. It's a really important award and one that we should all be very proud of. So what is ESPE? ESPE stands for the International Society for Pediatric and Adolescent Diabetes. It's the world's leading authority on pediatric diabetes. The award that Action for Diabetes was given is the ESPE Award for Innovation. Sorry, the slides moving around a bit. So it's the ESPE Award for Innovation in Pediatric Diabetes Care 2022. It's hugely appreciated, and it means so much to us all on our mission to give both health and hope to the type 1 diabetes community in Southeast Asia. Partnership is fundamental to the way A4D thinks and works. Our operational and strategic partners and key stakeholders at a country and regional level are essential. Our partnership with you the healthcare professionals that we work with is of absolute importance to our work. I live with type 1 diabetes myself, and know the importance of sustainable medication and education for the young people we support. This unmet need is huge and growing. Every month we enroll new type 1s on our clinic support programs, and the sustainability and ongoing growth and huge impact of these programs relies heavily on our close ongoing partnerships. Since 2015, in collaboration with clinics and medical societies, we've provided continual support to hundreds of young people with type 1 diabetes, thousands of insulin cartridges and HbA1cs, and literally millions of blood glucose tests. Together with your invaluable help, we've able to track and record everything that we do and the effect it has on these individual children and young people with T1D. This award was also in recognition of our healthcare professional advisory group, our network meetings like today, research collaboration, and our Hello Type 1 online resource center for type 1 diabetes information in regional Southeast Asian languages. For that, I'd like to call out Professor May Eng for her energy contribution and careful guidance in many of these areas I've just outlined. And again, this work is only possible with your close collaboration and commitment. As you all know, our aim and action for diabetes is to provide sustainable solutions for the T1D community in Southeast Asia. This ISPAT Awards a wonderful recognition of all of our combined hard work, partnership, and teamwork. So thank you again for being such an important part of this great journey. And I'll hand you back to Professor May. Thank you.
Thank you so much, Jerry. I think I can't stress enough that without the support of every healthcare professional, the families and caregivers and the people living with diabetes, you know, we won't be getting this prize. And one of the things that has come across is that we will be working with ISPAT further in the future. Hopefully we have a meeting set up to plan to collaborate even more. And ISPAT obviously is very happy to endorse the organization. So watch this space, much more to come. And we hope to have a lot more initiatives in the next years. The next presentation I wanted to talk to you about is really about the development of, in the last 18 to 24 months, we have progressed significantly within Southeast Asia. We have developed a very strong healthcare professional advisory group. Hand in hand with that, Jerry has also recently commenced in the last 12 months, the TAG group, which is the advocates with type 1 diabetes, mainly living in Southeast Asia, but also some in the UK and Europe. And together, we have developed a regional Southeast Asia diabetes healthcare professional network, a webinars program that is running every couple of months, and obviously research collaborations that will allow us to publish our data. So for the authors here, I really want to thank you for those, some of you are not here, but thank you to all the authors here who have given so much time in collating the data that we've had. And I will present the next slide. So as you know, in the Lancet Commission 2020, it was estimated that 15,000 people with type 1 diabetes had died in 2017 globally. And we have an estimated prevalence of 1.6 million. This was the commission from the Lancet in 2020. And I'm sure Priyanka Rai will be talking about the type 1D index, which will show that these numbers are much greater. Interestingly, there was no data whatsoever of type 1 diabetes incidence or prevalence available in Southeast Asia within this global Lancet Commission. There has also been very minimal data of health outcomes. It has been a paper in Thailand, the TIDA paper, and a more recent paper, but elsewhere in Southeast Asia, very little data is known. or published. We also know that it's really important that globally, people know that government funding for insulin and blood glucose monitoring kits are very limited in many of our low middle income countries. Now, we published the average glycemic index for type 1 diabetes between 2020 and 2021, and this was published in the Diabetes Research and Clinical Practice publication, which is the official publication of the IDF journal. Our average HbA1c was about at 83 millimoles per mole, and that's quite high. There were many other issues identified, and this is not any different to many of the other low middle income countries that we see in Africa or South America. But essentially, there are challenges that we see in insufficient infrastructure, the lack of universal health coverage, and lack of skills and professional knowledge are factors that have affected type 1D outcomes in many of low middle income countries globally. Next slide, please. I then talked about the development of Action for Diabetes, which was born in 2015 between two co-founders, Jerry Gore and Charles Toomey, who set up this charity to provide ongoing supplies of free insulin, blood glucose testing kits, HbA1 tests to hospitals, and emergency funds for complication treatments such as DKA and retinopathy treatments. And A4D has successfully, over the past 6 years, worked very closely with many of you. So thank you very much. These are healthcare professionals working within Southeast Asian countries, developing comprehensive partnership programs with the local hospitals is a real key. I think it's one of the real, I would say, USPs, of Action for Diabetes. By working with the governments, setting up memorandum of understanding through local hospitals and governments, it has allowed Action for Diabetes to go through many of the challenges that we went through during the pandemic. That was a separate presentation that I did in Rome and Abu Dhabi about how we managed to maintain continuous supplies in the most challenging of circumstances during the pandemic, and even in places like Myanmar that is facing great difficulties, but we've managed to maintain and not break the chain of supplies throughout the pandemic. Another really important thing for those of you who are not aware is that when A4D accepts a child, a young person into their clinical programs, it guarantees the supplies to them until they're 25. And this is very special as well, because without that, we can't provide insulin and blood glucose kits ad hoc. Type 1 diabetes is a chronic, complex, long-term condition that requires good diabetes management through the lifetime to prevent the risk of long-term complications. So we can't be in the business of just providing insulin ad hoc and then stop it. So one of the reasons when I first joined Action for Diabetes as a voluntary advisor is, well, I said, okay, that's fantastic, but why 25? And the answer given was, well, 25, we hope that we would be supporting them to actually have gainful employment and eventually purchase insulin themselves to keep themselves alive. And I said, that's quite amazing. For those of you who are not aware, not everyone does this globally. It's a very difficult operational process that's led by Fiona Uihut, who is just this amazing person that manages to tackle the operations of ensuring that every child or young person under the program does not have insulin at any point. Okay, so another background we found during the pandemic was that it was very difficult to hold face-to-face meetings. It was very difficult to hold the diabetes camps that Action for Diabetes have been holding. They've held over 1,300 camps over the past years, but all that ceased because of COVID-19. We realized, however, that internet access in Southeast Asia in the last decade, last 10 years, has become more affordable, more possible with cheaper phones and data access. And because of that, we felt that we would develop a form of digital access that is efficient to reach out to the families and caregivers and people living with diabetes, to reach out to healthcare professionals and collaborate on continued support for their type 1 diabetes, whether it's a healthcare professional or the young person. And next slide, please, Stacey. And we therefore developed these initiatives to facilitate cross-country collaborations, to exchange knowledge, to exchange best practice sharing. So what we first did was we developed a really strong network of healthcare professional advisory group, comprising of Southeast Asian, local and international experts in diabetes. We got together, we brainstormed, and we looked at the areas of education, research, and how to develop a sustainable healthcare system within this global region of Southeast Asia. We then thought, okay, we don't want to just limit it to the 30-odd healthcare advisory healthcare professionals group. I felt that, well, we need to develop a network so that anyone who is a healthcare professional, from the most senior professor expert to the most junior diabetes doctor that sees the patients and caregivers, well, anyone should be able to come to our network meetings, brainstorm, ask questions, share good practice. And we decided to develop this 18 months ago and organize this every quarter, open to everyone in Southeast Asia, and specifically to include allied healthcare professionals, nurses, nutritionists, dietitians. We have pharmacists, psychologists, and even students. So we thought that our first couple of initial meetings were very successful. People were very, very motivated and inspired. And we also developed an agenda. So thanks to AC and Charlotte, who runs and organizes the operational side of this, we had really good, fantastic presentations. We had Singapore presenting their best practice on peer support and etc. We also then, on our third initiative, we thought that we'd have to develop webinars as well, because we want to also start to upskill knowledge. While the network meetings allowed us to have conversations and share good practice and knowledge exchange, we wanted to develop webinars that were, again, freely accessible, given by key experts in diabetes for continued education. So these were pre-recorded, and through the Hello Type 1 digital platform, you can register and watch these webinars at any time. And we've had several webinars now. So if you're all haven't caught up, please log into Hello Type 1. There's two tabs. One is for the people with type 1 diabetes and caregivers, and the other tab is for healthcare professionals. And you should be able to watch all the previous webinars. They're fantastic. They're really, we want to develop this even further. So our ambitions are to try and get this, hopefully have subtitling, if possible, in the future, because what we found is it's really important that people who are not, where English is not their first language, can actually capture the education that we are trying to deliver. And for those of you who are not aware, I know that this is not on the presentation, but again, we presented this in Rome and Abu Dhabi. The Hello Type 1 platform is a really novel, another USP, I think, for Southeast Asia. It's a digital platform that provides key information for whether you're a parent, caregiver, or a person living with diabetes, or whether you're a healthcare professional. There is some amazing resources here. They're all sort of quality controlled, I suppose if you can say that. They're based on International Society of Pediatric Diabetes guidelines, ESPE guidelines, and even local and national guidelines. And what the special thing about Hello Type 1 is that on the top right tab, what we've been doing is we are translating all these resources into the native languages of Southeast Asia. We have to do it step by step. So we've started with English, then Khmer language, and Vietnam, and we're working towards Bahasa, and so on and so forth. So these have been extremely popular for, particularly, I can say that for the families and caregivers whose English is not the first language. And another very special initiative that I'm really proud to be part of. So next slide, we're just looking at some of the data analytics. Now, bear in mind, this was up to March 2022. So these numbers have now slightly increased. These are our healthcare professional advisory groups per country and per profession. And you can see that everyone is included in this. And we have invited our Indonesian key experts when I was in Rome and Abu Dhabi to hopefully be part of this as well. And we also have a variety of professions, so allied health professions, nurses, physicians, psychologists, nutritionists as well. And we hope to grow this as well, because as we develop our resources, translate them, we'll need more volunteers. So again, I stress everyone is volunteering their extra hobby time. So thank you so much to the people involved here. Next slide, please. Over here, you can see that the number of registrants to our regional network do go up over time. As I said, we initially had around 60. This meeting, we've had about 80, and half of you are here. Half will tend to log in through the Hello Type 1 website and view it in their own time, which I think is really fantastic as well, because we understand that everyone's got clinics and other commitments, but we want to give everyone a chance to scroll through when they log in what they need to listen to during these network meetings. So on average, over the last year, the numbers attending was approximately 60. And again, here are the analytics for the number of registrants. We do have mainly doctors actually registering to our network meetings. And I really hope that we can encourage the other healthcare professionals to. So for all of you who are physicians, doctors, or other health professionals, please do invite your fellow nurses, educators, nutritionists, dietitians, pharmacists to also register to our networks and webinars, because we are all one team. There's no one more important than the other. That's what I say to my own team all the time. And together as a multidisciplinary health professional team, we hope to support and improve the type 1 diabetes outcomes. And the webinars, again, we are approximately hitting about 155, and the last one was approximately 200. So these are slightly outdated in 2021 data. But it's very exciting to see these numbers keep growing. So thank you again, everyone. So please do encourage your colleagues, students, trainees, fellows, and healthcare professionals to log on. Next slide. So the important thing is that we keep progressing with our Southeast Asian initiatives. It's crucial to building a sustainable health capacity. It's crucial and essential to closing the type 1 healthcare gaps in Southeast Asia. I previously said that in our paper that was published, the average HbA1c is 10.1%. Okay. If you're not aware, the aim for type 1 diabetes is to get it down to close to someone without diabetes, which is an HbA1c of approximately 6.5%, 48 millimoles per mole. We're far off the mark, but to be fair, so is the UK and Europe, but the average HbA1c out of 30,000 children and young people living in the UK, for example, is currently at 8.1%. Okay, and we're trying to get this down to 6.5%. Really hard task. Now, it's taken the UK 10 years to get it down from 9.8% to 8.1%. So that's not an easy task. So we have a long way to go. We have a starting point now that we know of approximately 10.1 average in the region. And to get it down to an HbA1c that is close to someone without diabetes, so that you are reducing and minimizing risk of long-term complications. We have a task ahead of us, don't we? The other thing that is important with these initiatives is that we need to upskill medical knowledge. We need to get diabetes teams in Southeast Asia to have continued investments, to lobby their government, actually. I have to put that because that's so important. By making sure, hopefully in the future, there is national health coverage. There are many countries that may provide certain types of insulin, maybe not analogs, but they don't provide blood glucose strips, so they can't test, or they provide minimal blood glucose strips, so they can't test enough to adjust insulin or make changes. And that is like having a left hand without the right hand sometimes. We need both sometimes. We need the supplies, we need the medications, and essentially we need also the upskilling of healthcare professionals to educate. ESPE has one of their sayings, educate, educate, educate. So in the end, that is a hugely important aspect of improving outcomes in type 1 diabetes. We also need to strengthen our health systems. We need to work together so that as a network, we are stronger together. We may be stronger together in even driving change in policy. You never know, okay? So I'm not saying that, Laos can work within their government, but Southeast Asia as a network of countries may be stronger together as we take the first steps to close the type 1 diabetes gaps in this part of the world. So thank you very much for listening to this short talk that was done in Rome. I'm very happy to answer questions later. And hello, Dr. Agostini. I wanted to, and we hope to introduce you later, but we hope to include Indonesia into our advisory group and our network and webinars program. So I will leave you with this next slide, and I thank you for that. Oh yes, and that's just to let you know that I've launched my book recently, but this is my email and my Twitter, so anyone who wants to contact me about anything, please feel free. We do run special clinics as well. Tyler organizes this, so sometimes I run special cases that we can get together if you have a few cases that you're not sure how to change a BD to an analog regimen, or you're not sure how to adjust analog treatments or twice daily, 3 times daily insulin regimens. You can bring these cases together through Fiona or Tyler, I think, and we have set up special case-based discussions on Zoom, and we tend to discuss this together. So thank you very much, everyone. And I'll move on to the next one, which is introducing Dr. Amphayvanh Manivong to present our paper that was published in Pediatric Diabetes, the official journal for ESPE, on the 5-year outcome of type 1 diabetes in Laos. So thank you, Dr. Amphayvanh.
Dr. Amphayvanh.
Dr. Amphayvanh, are you able to present?
Dr. Amphayvanh, you have to unmute yourself. You move your mouse and the cursor on the bottom left. Can you find it? You move your mouse and then the cursor point to the bottom left. Then you should see a microphone icon. Then you unclick it. Is it possible? Oh, yeah. Hello, Dr. Amphayvanh?
Yes.
Yeah, we can hear you very clearly.
Okay. Everyone can hear?
Yes.
Okay, good afternoon, everyone. I'm Dr. Amphayvanh Manivong from Laos Hospital, Laos, PGR. Today, I will talk about Taiwan in Laos for 5 years of data. So first, could you back the slide, please? Okay. First, I would like to thank Professor May, Dr. Kaisi Lasabong, Dr. Daogyang Pomachak, Saritomi, Professor May, and all pediatrics in Mahosot Hospital to work very hard and support us. Next please. Okay, background. Laos is a lower middle income country in Southeast Asia with a population of 7. Universal health coverage for diabetic in Laos does not include insulin treatments and self-monitoring of blood glucose. There are only 0.4 doctors per thousand of Laos population compared to 0.8 per thousand in the United Kingdom. Before 2016, no Laotian site was known to have survived Taiwan into adulthood. A4D is the only charity that's the currently providing guarantee ongoing supply of free insulin, blood glucometer supply, hemoglobin A1C test, and hospital emergency fund to young people in Laos. The methods and study take account of 25 main hospital and 134 district hospital across 17 provinces, and Vientiane capital is a city prefecture. All children and young people were included in the study since the first patient diagnosed in February 2016. Demographic information includes patients
Is it the Wi-Fi connection, Doctor?
Yeah, I was about to say, is it me or
Yeah,
I think it's...
No, it could be from Laos.
Yeah, I think so. Do you want to take over me or what do you think?
Yeah, I'm just checking whether she's going to be unfrozen at any time. No.
Hi, Dr. Amphayvanh.
Okay, she's logged out and logged back in.
Let me text. Dr. Daogyang, are you still here? Let me see. Okay, I can see Dr. Daogyang is still here. Maybe maybe May, you want to quickly
I can, but I just don't want to take if she's coming back.
Okay. Okay, maybe just wait for, I think maybe we can just wait for a minute or two because I think she is definitely trying to dial in. So I think so far, maybe from the audience, from participants, if you have any questions so far that you would like to ask about this. Okay.
Yeah. Hi, Dr. Amphayvanh. Sorry, you were muted. You're
muted again. Can you, Dr. Amphayvanh, can you please unmute yourself?
Okay.
Thanks.
Okay, I'm sorry. Internet.
No worries. You were at the last point.
Okay. Okay, the methods Study in take account the country 5 main hospitals and 134 district hospitals across 17 provinces, Vientiane capital city prefecture. All children and young people are included in the study since the first patient diagnosed in February 2016. Demographic information includes patient, gender, age at diagnosis, hemoglobin A1C at diagnosis, diabetic ketoacidosis at time of the diagnosis. Hemoglobin A1C measured using cover A1C cell test analyzer in Nopopia Colimitis Korean in Mossad Hospital Clinical Biosimilarity of Laboratory. Next, please. The result. A total of 55 children and young people were diagnosed with diabetes in Laos and enrolled into the ESPE program between February 2016 and March 2021. 2 of the patients were diagnosed before 6 months old and were patients who have 2 neonatal diabetic and not T1D diabetic. Okay. 23 patients of 55 children and young people, 22% perform Vientiane capital city prefecture, and the other 32 cases, 58% were from 14 and 17 Laotian province. 98% of children were receiving follow-up diabetes care at the main hospital in Vientiane and the capital city of Laos. Patients who has been lost follow-up for passed away came from province and were located in the northern and southern parts of Laotian forest away from Vientiane. One case is from Atapu and one case is from Bokel, is very far. So the patient with T1D diabetic enrolled in the ESPE program in Laos at diagnosis and their follow-up status of 16 August 2021. At diagnosis, year in age in year mean 11.3, DKA onset is 57%, hemoglobin A1C is 12.7. The active follow-up is 85%, and lost follow-up is 11, decrease is 4%. Duration of T1D diabetic for enrolled patient in year mean 2.3 years. For the patient active follow-up in a year, mean is 13.8. Reason for hospital admission, DKA is 60%, severe hypoglycemia is 15%, and other reason is 13%. Next, please. Okay, the result mean hemoglobin A1C was 8.7%. Mean A1C for total 33 children and young people was 8.7. 1 to 5 years, 7.9. 6 to 10 years is 8.2. 11 to 15 is 8.4. 16 to 20 is 9.4, and 21 to 25 is 8.4. Next, please. Okay, conclusion. Achievement in Laos during 2016 to 2021 demonstrate as co-partnership between government and NGO was potential in developing sustainable and locally owned solution for diabetic care in children and young people with T1D diabetic residing in low limited income country. In addition, for provide insulin and blood glucose test kits for the patient, supporting education for healthcare professionals is also secondary importance. Okay, thank you for your attention. I'm sorry, my English is not my first language. You have any question? And thank you for listening.
Thank you so much, Dr. Amphayvanh Manivong. It's really fantastic to see this data, and you must be really proud because an average HbA1c of 8.7 is really something to be proud of. I think from our previous paper, Laos is the best actually in Southeast Asia. So really well done for looking after the type 1 diabetes children, young people so well. I'm going to leave questions to later if that's okay, and we'll move on to the agenda. So our next agenda, I'm really delighted to introduce to you Priyanka Rai, who's the Director of Global Policy in JDRF, and Priyanka will be presenting to us the Type 1D Index. So over to you.
Hi, everyone. Good afternoon. And thank you, May, for that introduction. And thank you all for the opportunity to speak to you today. And I'm going to be talking about the impact of type 1 diabetes and also what the index tells us. And this is based on a recently published work in the Lancet. So as you all know, around the world, in most developed countries, we know that with a relatively small investment in healthcare, a person that's diagnosed with type 1 diabetes can live a very rich and full life. Sadly, in 2022, the majority of those living with type 1 diabetes across the world still suffer from bad health outcomes for a whole variety of reasons, from inadequate tools, poor education, absent coaching, outdated training for healthcare professionals, and ineffective and inefficient clinical care models. So one of the drivers of this current situation is that we could not probably describe and quantify the scale and nature of the global challenge that type 1 diabetes presents. At the start of 2022, we were still unable to properly answer the most basic questions about type 1 diabetes. How many people have it? Where are they? How are prevalence, incidence, and outcomes of these individuals changing over time? What is the disease burden, including what is the financial impact of type 1 diabetes? Where is the need for change, support, and investment the greatest? So these were the questions that prompted us at JDRF and our partners to start working on the index. So I think if we go to the next slide, next one after this. Yep, so this is what led to the development of the type 1 diabetes index. So it was in response to this growing prevalence and burden. So JDRF and our partners, Life for a Child, ESPE, the International Diabetes Foundation, IDF, and Beyond Type 1 as well. We launched the type 1 diabetes index to help shine a light on these challenges and to bring attention to the increasing scale and prevalence of type 1 diabetes. So the index actually presents an opportunity for our organizations to join other key stakeholders like Action for Diabetes and other organizations around the world to build a worldwide movement. And we want this to be a living database. And in future releases, we will expand the index to include impact of economic costs, mental health, quality of life, other really important metrics that we know go towards helping us understand the burden of type 1 diabetes. And hopefully the data will also be broken down into regional and demographic levels. Right now it's at the national level. And we want to keep updating this underlying model with any new and more accurate information, because we want to make the index the most accurate and comprehensive picture of type 1 diabetes in the world today. So as you can see, we've published a paper in the Lancet. There's the website called T1Dindex.org. There's a dashboard which allows you to explore the data, and the entire code of the index is also available online at github.com. So I'll take you through the site in a bit, but I'll just talk to you a bit more about the data and where it comes from. So next slide, please. Oh, sorry, that just loaded. Yep, there we go. So we have a little quiz. So if you want, you can just put your responses in the chat there, but I have a question for you. You know, what percentage of the world's population is covered by at least one study of type 1 diabetes incidence? This was one of the first questions we had to answer when we started. So if you want to put your answers in the chat, but just because we don't have that much time, I'm going to skip to the answer. So if you go to the next slide. Next slide, please. Oh, yep, there you go. The answer is actually 75%. And we were surprised to find that there was actually, there were a lot of incidence studies out there. So we actually covered 75% of the world's population with actual data from countries. So that was one of the good findings we had from this work. And if you go to the next slide, this was a really interesting one as well. In which direction do you think the incidence curve of type 1 diabetes trends from age 30 and onwards? So you can see two curves on the screen. So there's the pediatric peak for the rest of the world. Sub-Saharan Africa has a different one because of, the different presentations there. But have a guess, where do you think the curve goes after the age of 30? I think you can pop it in the chat, but we will go to the next one, which might be surprising. It's actually upwards. So a lot of you got it. Well done, A4D. So the curve does actually tend upwards. And what we did find in the data is there's almost like a second peak in the age group from 50 to 60. So that was another interesting finding that we had from this analysis. And if you can go to the next slide, please. So this is a graph of T1D mortality. And as you can see, there's a sharp fall that happens at some point in time. Now, if you all want to take a guess in what period that happens, in what period did mortality rates fall dramatically for type 1 diabetes? And I will go to the next slide to show you. The answer is actually 1980s. And as will not be a surprise to most of you who work day-to-day with patients, it's actually the uptake of self-monitoring of blood glucose that resulted in that dramatic fall in mortality. So as you can see, a lot of good data in here for the index. And if you just go to the next slide, I'll talk a bit about where we get our numbers from. So for the index, of course, we relied on a multitude of data sources. So there was general population data from the United Nations. We expanded on the existing IDF Atlas dataset. There was an exhaustive list of incidence studies for both pediatric and adult onset. And there was also a global survey to inform us, to help us understand what diagnosis rates look like around the world, which was run in collaboration with ESPE. So overall, the simulation is informed by over 400 publications from around the world, some dating back to 1800, early 1900s. The survey itself with ESPE had about 500 endocrinologists, and we used the Markov chain Monte Carlo model to fill in all the blanks and have different what-if scenarios. So this research has, of course, been published in the Lancet. And the IDF Atlas team, who were key partners, are also planning to adopt this for the next version of the IDF Atlas. And the data will continue to be updated because, as we know, there's new research out there, like the study from Laos just showed before. There's more and better data that keeps emerging, and there will be a process of expert review, and we will keep updating the index data as well. And we welcome public submissions at any time, even, as we're planning to update our numbers. We know that there are people who have better ideas, better methodologies out there. So we're looking very carefully, and, we In fact, I think one of the things we're going to do soon is issue prizes to people who are able to improve the index and the methodology. So we're looking for ways to improve on our current modeling. This is open science is our aim here. Next slide, please. And this, as you know, I think some of you may have participated in the ESPE JDRF survey on different levels of care of type 1 diabetes around the world, which we're also planning to run another round of shortly. Next slide. I think you have gotten a few extra slides from my thing. If you just skip through a bit, yep, that one, how we test our numbers. No, just go back, yep, that one. So, you know, they say that all models are wrong, but some can be useful. These index numbers, index 1.0 numbers that we've come out with are within plus or minus 6% of real world data. So we've compared it to registry data where they exist, and we've compared it to all country prevalence studies where we've had them. And as you can see, they're pretty accurate, especially when you compare it to other estimates out there. And of course, we're excited about making the index more accurate and useful over time. But, you know, from where we have been able to test it, we know the numbers come in really close. Next slide, please. And here's the big number, the big global number. So what we've actually found is that there are nearly 9 million people living with type 1 diabetes around the world. It is now one of the fastest growing non-communicable conditions today. And in a lot of areas in the world, it's actually going pretty fast. The index estimates that the current prevalence is 8.7, but one of the unique numbers that we have in the index is that it highlights the burden of missing people. So people who would be alive if they had not died early due to complications from type 1 diabetes. And so as you can see, that number is fairly high. It's at 3.8 million across the world today. And as you can see on your screen, majority of these are people who, a lot of these are people who have been diagnosed but didn't get the right care and were lost to T1D. But there's a large number of that group of the grayed out circles who are missing and who have not even been diagnosed. So they didn't, you know, they died, and the report was that it was due to another infectious disease. So that's, of course, a concerning fact. Next slide, please. Another really, another analysis that we've done in the index is, for the first time, we estimate the healthy years lost to type 1 diabetes. And this represents the time lost to ill health, disability, or early death from living with type 1 diabetes. And as you can see, the healthy years of life lost to T1D on average are pretty significant around the world. On average, a 10-year-old diagnosed today can expect to lose about 32 years of their healthy life to the condition, leaving them with only a little under 42 years of unburdened lifespan. And most of this burden, as you can see, comes that nearly 25 years is coming due to early mortality caused by complications arising from type 1 diabetes. So, we do get asked, why are we choosing a 10-year-old as the benchmark age? And the reason is, we thought it strange to report life expectancy, for a newborn with type 1 diabetes, given that, well, they don't have it. So 10 is the peak age of onset that we're working with here, and it seems like the most representative age. So that's what the index modeling shows. Next slide, please. And yes, so how do the largest countries compare? So what the data does tell us is that T1D is putting a significant burden on those living with T1D, on caregivers, governments, and health systems. But what we can also see is that while the prevalence of type 1 diabetes is higher in developed countries, the prevalence of missing people, or people who should be alive, and as well as where the healthy life years are being lost the highest, is across low-income countries. So what we've found is that estimating the global burden by accounting only for prevalent cases, as is typically the focus in high-income countries, it grossly underestimates the true impact of type 1 diabetes. So as you can see, people in low to middle income countries are now living longer, and they generally, as healthcare standards are improving, and so incidence is growing much faster. And as these countries get wealthier, those with genetic risk factors are now exposed to more triggers. So as the background populations are also increasing, we think the burden of type 1 diabetes is actually going to grow much faster in the developing world. Next slide, please. And what drives this difference in the standard of care is, of course, the kind of care you receive. And I think at this point, this might be a good point to actually take you through to the website and share with you what it looks like in different parts of the world, and how and what the index suggests can change. So as you can see here, there's different sort of pillars of care. So there's people who don't get a diagnosis at times. So no care, no diagnosis. They have the shortest healthy lifespan, and they're losing a large amount of their life to early mortality. And then there's people who receive rationed, premixed, or very few test supplies, and they're losing a large chunk as well to shorten life expectancy. And as you go up that scale of the standard of care, so where you get to a point where you're getting insulin strips and you're able to self-manage your condition, you do win back a majority of those years lost to complication. And with new advances and better care and technology like pumps and CGMs that you have access to in high-income countries, we are able to win back most of that time that T1D is stealing. So without further ado, what I might do is share my screen and take you through to the website. I think you may have to enable screen sharing. Here we go. All right. So the type 1 diabetes index is t1dindex.org. And when you get to the website, you'll be able to scroll down and there's a map of the world. And you should be able to scroll to whichever country you want to see. And it gives those three high-level figures around what is the prevalence, the missing prevalence, and the healthy years of life lost. So for this demonstration, I'll click with a Southeast Asian country. Let's go to the Philippines. So you can double click. You get a content warning, of course, because the material is sensitive. And on the website, once you get to the country page, it'll show you the number of people it estimates living with type 1 diabetes, the number of people who should be alive. You can click and it tells you what does that mean, what is the statistic, and also the number of healthy life years lost. And if you keep scrolling, it shows you how rapidly it's growing in different countries, how dangerous the condition is. But in growth, if you learn more, it'll compare it to how many people are impacted now, how many will be impacted by 2040, how fast is type 1 diabetes growing in comparison to type 2 diabetes, to other conditions like HIV or asthma, tuberculosis, the background population of the country. Then you can also look into why is it dangerous? How many years is the condition stealing from the average person living in the Philippines? And as you can see, the average 10-year-old in Philippines enjoys 74 healthy years of life. And you click on it and it shows you a comparison as well. So what's the loss in terms of in Philippines compared to other leading peers in other countries in the same income group? So Philippines actually isn't doing too badly compared to its income group, but it still means there's about a child who develops type 1 diabetes at the age of 10 will lose an average of 46 years of healthy life to the condition. And the main data that the index does actually prompt you to is, how do you improve this? Like what needs to be done to change this? And here is where you see that, if everyone in the Philippines had access to a timely diagnosis, so we weren't losing any children to misdiagnosis, that would be 2.8 healthy life years. You can click on all of these cards and it takes you through what the impact is of losing this time. People who develop type 1 diabetes, how many birthdays were not celebrated. So it's a very intuitive website. And the main impact, of course, is for insulin and strips, getting access to that basal bolus regime, and it's multiple daily injections and frequent monitoring, and that adds back 21.7 years, really 22 years of healthy life back. And the number of people that are lost because they don't get access to that care. And each extra test strip that a person in the Philippines uses can actually add 3 years of healthy life back. So it's a powerful information to help you advocate, but it's also powerful in terms of when you're speaking to your patients who are reluctant to test, just conveying it to them in a way that's meaningful for them is an important part. And of course, if you click on the impact story, here we go. We have an impact story from a very familiar organization to everyone here. And there are examples, like we want organizations like A4D to sprout up around the world. We want everyone to have access to the information and support that they feel like they can do this too. The other thing that we do also encourage is we want people to understand that there are devices and technology out there that can help improve your glycemic control and management of type 1 diabetes. So we don't want to restrict this access only to high-income countries. We want anyone anywhere in the world to understand that with more frequent glucose monitoring, with the aid of technology, you can actually have access to as much of your lifespan as possible. In fact, in a lot of Nordic countries, you might actually live longer than the average lifespan because you're so attentive to your health care. So this is the index at a snapshot. We do also have a lot of resources for people, how to change the numbers, obviously social media content, but also campaign guides, how to run your own campaign, how to advocate for change. And we're trying to build a whole community that can support access to better care for people living with type 1 diabetes around the world. And as I said, all the paper is available online, the way we do our modeling. There's another website which is completely dedicated to deep diving into the data to understand where do we get the information from, what are our assumptions around the incidence, percentage, etc. So this website is for those who are really interested in the data. And you can go in here. I'll stick to my example of Philippines here, and it'll pop up all the numbers just for Philippines and detailed graphs, etc. So all of this information is available. So it's a very rich source of data. And of course, we want you to use this in your own studies, in your own research. There's a whole heap of other factors you can select and choose and play with. And if you don't find anything in here, feel free to reach out to us. We are more than happy to work with you to give you the data that you need. So please do explore. And I might stop sharing at this point. So please do explore.
Put the link in the, Priyanka, I've just put the link to T1D index in the chat.
Yes, fantastic. And I'll put the dashboard link in there right now as well. So please do explore the index, explore the site, and do reach out to us if you need any more information. We'd be, of course, delighted to help. And I've got some, I'll take questions maybe at the end then.
Thanks, Priyanka. I think that's a fantastic presentation and such a fantastic website. So much data. I'm sure we'll have questions later, but everyone hang on. We have one more presentation from AC, then we have an open floor. So the next presenter is Anne Charlotte Fisherell, who will talk to us about the Hello Type 1 digital platform updates. So over to you. Thanks, May.
Well, hi, everyone. I think most of you actually know me. So we have created Hello Type 1 2 years ago as a pilot project, first in Cambodia. And as you know, sorry, I just have an issue with my recording to make sure that, do you see me when I talk?
Yeah, we can see you.
Oh, okay, super.
Yes.
It's not just working on mine. No, it's fine. I will do that. So yeah, sorry about that. So Hello Type 1 is a pilot project that we have launched 2 years ago in Cambodia. And it was the first educational platform that we have built with Action for Diabetes to finally allow all the young people in Southeast Asia to have access to information and educational content in their own language, because they could find information in English, in French, in German, in many languages in the world, but not in their local language. So we have built this platform. This platform exists in Cambodia. We have launched it in Vietnam. And today what I want to focus is on Thailand, because we are very, very delighted to say that currently I'm working on the adaptation of the website in Thai. So we will launch Hello Type 1 in Thailand during World Diabetes Day, because as you know, the IDF slogan for this year is Education for Better Tomorrow. So what is better than an educational platform in local language for Southeast Asia? So we use this occasion to launch the platform in Thailand. So the platform is really there to educate and empower the whole T1D community. When we talk about T1D community, we are talking about the type 1 diabetes, the people living with type 1, their caregivers, and as well all the healthcare professionals. So we have developed, I don't know if Professor Tanini is with us today, but I want to again say thank you to her. Thanks to her, because she really, really supported us, and her team at Chulalongkorn, at the Faculty of Medicine at Chulalongkorn University in Bangkok, helped us to adapt all the content in Thai. And I know that she spent a lot of time as well reviewing the content to make sure that everything was adapted to the Thai culture and the Thai guidelines. We have worked as well, the team as well is linked with the School of Global Health in Bangkok. And we have as well did everything in partnership with the Diabetes Association of Thailand. So the platform will be live on November 10. We will be there at the work rally hosted by the Diabetes Association of Thailand at the Chulalongkorn University Garden. So there will be a walk like for World Diabetes Day, but there will be as well a place for the type 1 and their family to gather, and there will be some art exhibition, and Hello Type 1 will be there. We will have our ambassadors, Marlena, and we will have as well Grim, who are two young people with type 1 diabetes who are supporting F4D. And they will be there to show the platform to the other young people. And on November 18, actually, our Thai audience, our Thai healthcare professionals that are here with us today, you will receive another invitation from me to participate to an online event. So it's going to be an event when I will demonstrate the platform, show you all the type of content there, how to access it, how to share the information with your patients. So we will have video content, poster content, articles, little quiz. We have social media platform. We will create as well a Line channel, because in Thailand, if you don't have a Line channel, I think difficult to spread the information. But we are very, very excited, and I'm working very closely with Professor Tanini team and as well our T1D ambassador, because we are building the platform for them. So it's important to have them involved in each steps. So in your country, so we already launched in Vietnam last March. Cambodia was the first country because I was living there as well for 7 years. So Cambodia was very, very close to my heart, and I was still in contact with all the healthcare professional community there. So we focused on Cambodia first, and it's a very, very big success in Cambodia. We have like more than almost 1,500 followers on our Facebook page in Cambodia. And when you take the numbers, it's quite high. So we are very, very happy that we had been able to reach almost the whole T1D community there. Vietnam, it was in last March, and we are still working to build this community there. Now we will be in Thailand. In a few months, we will be in Malaysia. So we are adapting the content in Bahasa thanks to as well a very strong partnership with the University of Malaya in Kiel. The team of Professor Azrianti and Professor Yazid really helped us, and we are working as well in partnership with the Malaysian Diabetes Educator Society and the Malaysian Endocrine Society as well. The next step will be in Myanmar. Actually, we already have the content translated and ready to launch. Then Laos, and we are starting to actually thanks to Dr. Agustini, who is in this call. I think it's going to be the first meeting to start to see how we can implement Hello Type 1 in Indonesia. And then it's going to be Philippines. And that's really fantastic because it's going to be the first time in the world, actually, that there will be one platform dedicated for Type 1 education in local language available for the whole region, a whole region in the world. And we are very, very happy and proud that this platform will be able to help the whole community in Southeast Asia. And that's very important because you can provide them insulin for them to stay alive. But as we saw the number, thanks to Priyanka and the T1D index, it's sustainable only if they really do self-management and understanding their condition and being independent and empowered is the first step to progress as well. And yeah, I think my big message is that Hello Type 1 exists only with you, with the healthcare professional community, because the patients are coming to you. You are the first row. And after, it's really important that the platform is here as well to, not only for you as well, because as May mentioned, we have a healthcare professional category with those, actually those meetings, the recording is always there. We have as well all the webinars, our publication, you can access to everything. You have a category there. But mostly for the T1Ds and their patients. So basically all information are there for them. So you just need to pass the information to them. They can see a little video about food, understanding what is a carbohydrate, tips like how to live at school. And more we want to create as well online workshop. Actually in Cambodia, we run 3 online workshops. Actually, thanks to Dr. Priyanka, who is online, who did a workshop about nutrition in Cambodia. So it was a Facebook Live where the patients and the parents can directly ask questions to them in the chat. It was very, very efficient. And Professor Malin from Cambodia as well, she did a workshop on living with type 1 and COVID. And I think more and more we need to do this type of workshop because sometimes we cannot reach the patients, but online everything is easy and everyone has Facebook. And in Southeast Asia, actually, even if people are living sometimes in poverty, they still sometimes have access to a smartphone and cheap data. So that's a way we can find to reach them and to empower them. So what I want to share as well is that you can always reach out to me for any ideas. It can be an online workshop that we can run like we did in Cambodia. It can be new content. It can be, I don't know, new webinars. It can be any idea you can have. You can always come and I will be very, very happy to implement your idea in your country. So yeah, looking forward to see the Thai HCP in the Thai event. So it's going to be on November 18. And yeah, very, very looking forward to see Hello Type 1 in a new language. And I think that's it on my side. So we can open the Q&A session. Yeah, up to you, May.
Thank you so much, AC. I just want to stress how important and how incredible the progress has been since the birth of Hello Type 1. And in the next 18-24 months, we have our ambitions to cover the entire region of Southeast Asia. Again, this is the first ever in native languages, a digital platform that is accessible freely for all healthcare professionals and all parents, caregivers, and people living with type 1 diabetes. I can't stress how important education is. It's education, education, education. Please take heart what AC has said. We want to support any new initiative, ideas, a workshop. We've not been able to resume our diabetes camp, and we hope to do that next year. But we found that having an online workshop was as beneficial because many people may not be able to travel hundreds of miles to a diabetes camp or take time off work, but they may be able to join in on an online session. So if you are willing to run a session on nutrition, on exercise, on basic questions, for example, for a newly diagnosed type 1 in any language, please contact AC because we would be able to support you in hosting this on the Hello Type 1 platform. Of course, you have any further ideas for webinars as well, we would love to do that. So I'm going to now open the floor to any questions. If we can close this, so hopefully, please put your cameras on if you are not too shy. It'd be nice to see everybody as well. If you don't want to, you can always put it on the chat box. I know we've had one question from Professor Ni to Priyanka Rai, who's been answering that online. So please do unmute and have a discussion or any questions. So open to the floor, anyone who wants to ask questions. There's a hands up, isn't it? Somewhere. Yeah, there's a hands up, raise your hand icon if you want to ask any
Priyanka, do you want to take that questions next?
Yeah. No, so we did have a question in there about the Lao data. Where I think someone has reported that it is 74 and, where we got the index numbers from. So the index, where we don't have direct incidence and prevalence numbers from a country, which as we know, publishing numbers, collecting that data can be very difficult. What we do have is a methodology that estimates based on other geographically and, similar income classification. So I've put a link there to our paper that actually explains the methodology. So we know that, like we said, we only have data for 75% of the world's population. And a lot of the countries where the data is missing are low to LMIC countries. So we know that's a big gap, but we've used a methodology to try and predict and estimate what the numbers should be. So of course, they're not accurate, but where we do have registries available, where we do have the data available and we compare, they come in really close. But as I flagged, part of the work that comes from putting this data out there is collecting new information like the one that was discussed on Laos, etc. So as we have more information, we'll build it into the country, obviously, into the index. Obviously, direct country data will supersede anything that's based on incidence from other countries.
Thank you, Priyanka. Professor Ni, would you like to respond?
Yeah, hi. Dr. Rai? Yeah, hi. Thank you very much for answering my question. I think it's a great job and a great vision that this whole effort of trying to estimate and project the numbers. You are just not confining to prevalence, incidence, but you have also taken on the effort to estimate mortality as well, and how many patients and how many life years has been lost. So I think this is great effort, and I have to congratulate you and your team for being so ambitious and brave to do this. All right. So because Dr. Amphayvanh from Laos is online, so I thought this is a very good platform to discuss this particular case. I'm just drawing out this case. I'm sorry, maybe I'm being a bit too unfair on you. putting you on the spot and things like that. But I just kind of look at the website, and it's showing me that 1,000 people should be living with type 1 diabetes, and actually not too far away, 1,018, it should still be living. So there shouldn't be that much death around in the country. But Dr. Amphayvanh has just indicated that there are 74 patients in the country. Yep. So it looks like there's a 10-fold discrepancy, at least, in terms of the projection and the actual number. My concern really is that if the entire type 1D index currently is country-specific projections, because it looks to me, correct me if I'm wrong, it looks to me that you're projecting each country and then adding it up and then reporting the overall worldwide number. So I'm a little bit concerned about propagation error. So if let's say each country is not accurate, then if you add up certain numbers of inaccurate number, it's becoming more and more inaccurate. Although there might be an element of regression to the mean, for some countries you might overestimate, for other countries you might underestimate, and so the final number may actually still be okay. But we will never know in countries where there's no data around. One of the very striking example I can think of, if you use neighboring countries to estimate a country where there is no data available, then it may actually not be very accurate at all. And this example is really springs to my mind is startling. There is a big difference in incidence across the Russian-Finland border.
Yep.
Right? So I know the recent Russian-Finland border has been in the news because when Russia announced enlistment of their people, their men into the Ukraine war, there has been a flood across that particular border. Now, Finland, on one hand, across one side of the border, has very high incidence. But on the other, on the Russian border, on the other side, the incidence is very, very different. So I'm just a little bit concerned that if you use Thailand data to estimate Laos data, maybe similar things might have contributed to this tenfold discrepancy.
Yeah, absolutely.
Because if it is actually accurate, then I think Dr. Amphayvanh has and her team has work cut out to go and look for the remaining 900 patients.
Yes, we actually have the option.
And I think this is very important work. If this is really accurate, then we better start looking for all these missing Laos patients.
Well, I think we have the similar but opposite problem in India, where we've got, with index estimates, there's about 860,000 people alive, and they have the largest missing prevalence of 900,000. And when we go there, people are like, it's impossible. There's definitely more. You know, there should be 1 million in India. So, and the problem there is the study that we're using for India is the YDR registry data. So it's a government-run registry, but it's a multi-center study, but it doesn't cover the whole of India. So this is the problem we're going to have in data and representation, especially in an area like T1D, which has been neglected by research in a lot of countries. So one of the findings that comes out from the index and that we highlight in the paper, and which actually Marta Koch, the editor of The Lancet, actually wrote in her editorial about, I'll put a link to that, is the need for registry data, is the need for countries everywhere to track and understand what the impact of type 1 diabetes is. Because, you know, as ambitious as it is, at the end of the day, the T1D index is a model. It only runs off the input that we put into it. And where we don't have input, yes, we've made, you know, some very judicious, we've used machine learning, we've used a lot of methodology and algorithms to try and predict what it can be, but it's never going to be as accurate as real world data. So it actually highlights the need.
Yeah, go on.
So it actually highlights the need for people in Laos and in countries where there isn't that data available to advocate for that research, to advocate to build registries where and support the community. So what the index gives you is an estimate, and if you can see there's a big gap between estimate and what you're seeing in real world, use it to advocate for better support to get that data.
Yeah. Thank you,
so,
Professor.
Can I have in the meantime a suggestion?
Yeah,
because
sure.
If you go to the if you go to the Type 1D Index website, you can actually dashboard. You can actually download.
Yes.
What is known as a fact sheet.
Yes.
So I think perhaps we should not call it a fact sheet, because these are estimates.
Yes.
So it can be quite misleading in the meantime. So what I would suggest is to change the name of a fact sheet to estimates or something. Something.
Very good point.
Yeah. And also for countries in which data is actually available, put where the data is actually projected from.
Or you can see that.
Yeah.
So you can see it in the dashboard.
On the fact sheet itself, so-called fact sheet. So that
okay. So
I can print out my country's fact sheet and go to my government and say, look, there's no data, because it says that reference what reference is this projection drawn from? Zero. No data. So I can actually advocate for a registry to be set up, and the same can happen to can also be done in all the other countries as well. And if, let's say, there is some data, some basis for the projection, like for the Laos, you have kindly given a link for the Thai paper. So just put that in, and then let whoever who wants to do some modeling, clever modeling to actually improve and win your prize that you have kindly put out, then they can do that. Actually, looking at the reference that you have just sent out for Thailand in 2011, the incidence was reported there as 0.6 per 100,000 per year.
Still one of the lowest in the world, yeah. Yes,
actually from our Laos paper and looking at the last 5 years, it's an average of 0.3 to 0.4 per 100,000 per year of incidents. Even though in our paper we did not report incidents, the data is actually in our appendix. So it's all there. We have shared with Professor Graham that data and directed his attention to the supplementary material in our paper for Laos that Dr. Amphayvanh has clearly presented just now. So, but if we take, sorry, May, I'm hogging, isn't it? If I take the actual data that we have of 0.3 to 0.4 per 100,000 per year of incidents, then it is not very far away from the Thai 0.6 per 100,000 per year, which then actually suggests that perhaps the modeling can be improved as well.
Yeah. No, I mean, I think that's definitely something we can flag. And Dr. Ogle is, of course, one of the co-authors of the paper. So we'd be delighted to get new data that we can add.
Thank you
so much, Pravni, and thank you, Priyanka, for answering some challenging questions. I think what we have to understand is it's a fantastic site that is at the starting point. It's a journey, isn't it, as you've said? And it's a journey of improving the modeling as we get better data published about incidence and prevalence. I do agree that there are, taking a country for the neighboring country, there are vast differences even in Europe, for example, and there are still many unknowns, things that we do not know, which is genetic differences, what causes someone to develop type 1 diabetes more than another person, and we don't have these answers. Environmental genetics have been looked at for decades. So I suppose the question is, you will continue to improve the data set and the modeling as more papers come out with the type 1 index. Is that correct?
Great. Yes, absolutely. That's the intention, to reflect real world data in the index.
Great. So thank you so much for that. I am going to open the floor to anyone else who wants to ask any questions about any of the presentations, any ideas about workshops online or future camps or Hello Type 1. Does anyone want to raise their hands or?
I think maybe I just want to remind the participants here that, Priyanka, from JDRF, she's very kind to give a presentation on T1D index. And this is not in specific of any Southeast Asian country that we have here. Of course, Philippines, but for the participants here, if you would like to have in-depth discussions or further discussions about your country data presented on T1D index, you can either reach out to me. I'm happy to facilitate the connection between you and Priyanka, or you can also reach out to Priyanka directly that, we can organize a talk or a discussion like this, a country-specific discussions on the T1D index. So you can think about that and then let us know.
Yep, thank you, Fiona. And I agree. I think a lot of it is to try and advocate and lobby even for your governments to develop a registry. And the previous presentation that we did, there was no data, not a single mention of Southeast Asian countries in the Lancet Commission 2020. 2 years later, we have possibly one paper. Or two with Thailand. So we have much to do with getting more access, getting more insulin access, getting more registries done. And I do wonder whether we would be able to work better as a whole network. And hopefully that's something that JDRF could even support this in the future with us working as a region. A global region is, the power of many is much greater than the power of one. So hopefully there'll be more to come in the next in the next year or so. So anyone else wants to bring up any other questions? Do we end at 10? I've forgotten to look at what time is that?
I think we are 7 minutes past the initial time.
Oh, okay. So I really want to thank everyone then for everything that you've done. It's just a fantastic journey. Hi, Dr. Agostini. We hope to have a separate meeting with Indonesia over the next weeks to get you on board with the Hello Type 1 platform. Thank you to everyone again. So I will close this, but I've got one question from Mane. Most of the countries in the studies lack dietitians and psychologists. You're absolutely right. What can be done? Well, I'm looking to you then, the key leaders in your own countries. What do you think could be done to fund the other multidisciplinary health professionals to give more sort of roles to specialist diabetes nurses, nutritionists, dietitians, and psychologists? It's not an easy question, Mani, because we don't even have in many countries universal health coverage for blood glucose strips that are adequate. You've seen Priyanka's presentation that as you improve education and management of type 1 diabetes, you also then improve their healthy years. You reduce their mortality and morbidity. And many of our countries are at the first step, not so great insulins, non-analog insulins, and not enough blood glucose strips. So how do we move across, to the right-hand side to provide better insulins, basal bolus regimens, and more frequent monitoring? I know how hard it is. Really. I grew up in Malaysia, and we have to buy strips. It's impossible to actually get people. What do? Do you buy strips by telling them one strip will improve 3 hours of your life? I mean, I like that statement, but on the other hand, they're going to feed the family with that same amount of money. It's just, we're in an impossible situation at times, and we just somebody So I thank you, everyone. Please carry on. Please carry on advocating, lobbying, supporting, work together, and we're here to support you. So thank you, everyone. We have over 90 registered, and at one point we had 50 attend this meeting. This is fantastic. We'll keep having these meetings. Those of you who have missed it out, please let your colleagues know you can view it. And I'll see you next time at the next network meeting. So thank you so much to
Thank you,
Dr.
everyone.
And Priyanka as the guest speakers. Thank you to Fiona AC for organizing this. And thanks, Jerry, too. Okay, see you guys.
See you again. Bye-bye.
Bye-bye, everyone.
Bye.
Bye. Bye.